For the last decade, according to the Centers of Disease Control, if you died in the hospital, you likely died of heart disease, cancer, trauma, a respiratory illness, or a stroke. Specifically, in 2013, 611,000 people died of heart disease, 584,000 people died of cancer, and the third leading cause of death that year was chronic respiratory illnesses, responsible for 149,000 deaths. However, a report from Johns Hopkins University, after reviewing data over 8 years, including over 35 million hospital admissions, indicate in-hospital medical errors were responsible for 251,454 deaths, making it the actual third leading cause of death in the United States. One important question really is, how accurate is this data? But a more important question, and for the purpose of this video, I'm going to focus on 5 things that you can do while you or a loved one is in the hospital that will significantly decrease the chance you become a victim of a medical mistake. Basically, things you can do to try and not die in the hospital. And after going over these tips at the end of the video, I'll tell you why on death certificates it never says medical mistake is the cause of death. And the reason is pretty interesting and probably not what you think it is. The first tip and the first thing you can do to keep your loved one from dying in the hospital is be there for them. Be there every minute they are in the hospital. And I know it's difficult. You've got a family to take care of. You've got a job. But whatever it takes, if it's you, if it's other family members that can be there, if you have to hire somebody, have somebody there with your family member at all times. This is important for several different reasons, but the reality is if you're not there, you can't help out with tips 2, 3, 4, and 5 of this discussion. There are literally innumerable advantages if you can be there for the patient. Everything from decreasing patient anxiety, it keeps their spirits up, you can help them to the bathroom when they have to go instead of having to wait for a nurse or nursing assistant or anybody, which also decreases the chance they're going to fall. The list literally goes on and on, but one other key factor, especially in the older patient demographic, is it will significantly decrease the chance they suffer from sundowning. Sundowning is a state of increased confusion, anxiety, agitation, oftentimes unnecessary walking or pacing around the room or hallways. The exact cause is unclear, but oftentimes it occurs in an elderly population, think about your parents, in an environment they're not familiar with, think about the hospital. And unfortunately, all those symptoms that I mentioned, the confusion, the anxiety, the aggression, typically in the hospitalized setting, they're going to be treated with some form of anxiolytic or sedative agent, and unfortunately, there's where the snowball starts to happen. The side effects of these medicines, somewhat counterintuitively, can lead to increased agitation, but more commonly, they lead to increased falls, increased aspiration, increased hypoxia, and all of those side effects require significant interventions. For example, the fall that may ultimately lead to what was an unnecessary hip fracture, or the aspiration that potentially leads to pneumonia, or the hypoxia that leads to intubation that they never come off the vent from. All of those things can theoretically potentially be avoided if we can avoid sundowning, and sundowning can potentially be avoided if the patient is in a more familiar environment or at least has somebody there with them, like a family member that can comfort them in these times of increased stress. And I get it, it's difficult. If you can't be there, bring their favorite pillow, bring their favorite blanket, put pictures all around the room, but nothing is going to beat you being there so you can be the advocate for the patient. The second tip I have to avoid unnecessary death while your loved one is in the hospital is know the MAR. The MAR stands for Medication Administration Record, and it is a record of every medicine they are going to get scheduled or on an as-needed basis while they're in the hospital. I remember back when I was an intern, and this is in 2009, there was a patient, and this wasn't me, I promise, but one of my colleagues had ordered epinephrine to give to a patient who was having a fairly significant allergic reaction. He ordered the epinephrine to give intramuscularly, which is pretty standard. Unfortunately, the nurse gave this intramuscular dosage intravenously, and I'm not trying to throw the nurse under the bus here. There were a lot of checks and balances that went overlooked, but the point is, the patient received a much stronger concentration in the vein that she shouldn't have received of epinephrine, and instead of being treated for an allergic reaction, she ultimately went on to have a heart attack. Fortunately, she was young and healthy and there were no long-term effects from this medication error. However, if she was older, if she already had heart disease, that's going to be a much different story and potentially fatal interaction. The point to tip number 2 is you need to know the medicines that your family member is going to be receiving while they're in the hospital, and there are 2 things you need to do that. If you have a loved one that you can see yourself potentially needing to care for while they're in the hospital, then you need to know what medicines they are already on before they go to the hospital. You can't rely on your loved one to know, and you certainly can't rely on the hospital to know. For example, their primary care physician may be on a different network than their cardiologist, who may ultimately be on a different network than the hospital, and potentially the pharmacy may be closed. So if you can show up with the list of medicines, it's going to go much smoother. But additionally, while they're in the hospital every morning, ask the nurse, ask the doctor, what are the medicines they are scheduled to receive? And by scheduled to receive, I mean what medicines in the morning, what medicines at lunch, what medicines in the evening, what medicines would they get on an as-needed basis, like the occasional nausea or the occasional headache? Because medication errors are one of the most common errors while in the hospital. And if a physician or nurse comes in with a medicine that's not on the MAR, and you don't know that it's not on the MAR, and they push it inadvertently thinking they're with patient A, but they're actually with patient B, you're not going to be able to avoid that. If you know the MAR, when they come in to give a medication, they will tell you what medicine they're about to give. They're supposed to anyway. And you'll know if your loved one should be getting it or if they shouldn't. And if it doesn't sound like it was on the MAR, you can say, hey, can we double check this? Has there been a change or should you be in somebody else's room? I know medication mistakes shouldn't happen, but $90 million government planes shouldn't go missing either. And this thing went missing a few months ago. They actually found that jet about 100 yards from my backyard. That story was crazy, but I digress. The third tip I want to mention is avoid the hospital at all costs. And let me tell you what I mean. I have a family member that suffers from atrial fibrillation. He had been on several rounds of medication, and for whatever reason, over the years, they began to not work as efficiently as they did previously. After speaking with his cardiologist, they wanted to put him on a medicine called Tecousin. The problem with starting somebody on Tecousin is to start it, it requires you to be in the hospital for 72 hours for no other reason but to start taking this medication. While you're in the hospital, of course, they monitor you, they do serial EKGs, but they're not doing anything else. You are literally getting exposed to all the risk of being hospitalized, and the only benefit is starting this new medication. So I called his cardiologist and explained to him my concern about bringing in this family member of mine who is well into his 80s into the hospital, potentially unnecessarily, and asked if there was an alternative medication. As I said, I explained my concerns about coming into the hospital. The cardiologist voiced understanding, and he said, you know what, instead of Tecousin, we can try amiodarone. We both had the agreement that if the amiodarone didn't work, then we would probably have to go to the Tecousin and come into the hospital. But you know what? The amiodarone worked. My family member is doing fine. He avoided the hospital and everything was great. The point of this is oftentimes, especially in the emergency department, because there are a lot of shades of gray of treatment plans, the physician may come to you and say, hey, for the treatment of your, for example, cellulitis, we can start intravenous antibiotics and bring you into the hospital and monitor you for improvement, or we can start antibiotics and send you home, and if you get worse, you can always come back. If a physician is giving you treatment options, that always means there is no data that says one way is better than the other. And I would strongly encourage you, if you're giving the option to begin a treatment at home, take that option. You can always come back to the hospital if the medical therapy doesn't go according to plan. The fourth step into avoiding in-hospital mistakes is to make sure you are 100% discharge ready. Last year I heard about a case of an elderly woman who fell at home and broke both of her kneecaps. She was discharged home at her request. Family members dropped her off to the house. She walked inside, fell again, ended up right back in the hospital. So again, if you're being discharged, make sure the home situation is ready. If you came into the hospital not requiring crutches and you're leaving requiring crutches, make sure you've got the help you need to go up the steps if necessary. Make sure things are cleared off the floor. If you went into the hospital not requiring oxygen, but you're being discharged home on oxygen, make sure you've got all the equipment already at the house before you leave. And more importantly, if your family member has been in the hospital for 3, 4, 5 days or longer, they are going to be deconditioned. You or somebody will need to spend the first 24 hours with them at home as they get reacquainted with everything around the house. Make sure they are strong enough to get from the bedroom to the kitchen to the bathroom, make an easy meal, make sure they can eat and get their strength back. If you drop them off at home and none of these things are ready, you're going to end up right back into the hospital, potentially sicker than you were when you went in the first time. I'm going to get to the fifth reason in just a second, but let me tell you why medical mistakes don't actually show up on death certificates, even if it was clearly the cause. On death certificates, when a physician writes down the actual cause of death and the other medical conditions that ultimately led to the cause of death, he has to put down an ICD-9 code based on billing. And an interesting fact is medical error is not an ICD-9 code. Another thing that leads to underreporting of medical errors is, you can imagine, lots of times these end up being litigated in courts. And more times than not, they're ultimately settled, and part of the settlement oftentimes are gag orders. So most patients don't even have the legal ability to talk about the medical error that they or their family members suffered from. So the point is, whether the Johns Hopkins data on whether or not over 250,000 deaths are attributable to medical errors or not is accurate, we know they occur, and there are steps you can do as a patient or family member to decrease those odds in your favor. So let's talk about the fifth one. The fifth way to do this is to absolutely stay healthy, and it's not for the reason that you think it is. Of course, staying healthy has a whole lot to do with staying out of the hospital, your longevity, and your overall medical health. But in my opinion, the most important reason to stay healthy has nothing to do with those reasons and has everything to do with the fact that you are